Hope everyone's doing well. We appreciate everything that you guys do for us, and we appreciate the time you're taking with us today to review some of the products that we have for 2024. My name is Pat Hefner. I'm a sales relationship manager with Medica. I've been with Medica about 3 years. I've been in the industry for a couple of years, longer than that. And then Leapley, my Medicare guru, is going to come in after me. Justin's forgot more about Medicare than I'll ever know. So let's get started. So our individual and family plans for 2024. First of all, great news. Wanted to let you know that commissions are increasing. So right now for 2023, commissions are $18 per member per month. Next year, they're going to $20. So that is a fantastic thing, and I think that brings us in alignment with our competition that we have. As well, what we do is we're going to have a growth bonus for 2024, and the bonus is $200 per net change of members. So how we do that is we've snapped the line in May of 2023. So that's your baseline. And if somebody had, for an example, 100 members, and then we're going to snap that line the middle of May in 2024, and if that grows, then you receive a bonus based on the number of member change. So from the example that you can see on the screen, we started off at 100 members in 23, we got 110 in 24, you get a $2,000 bonus. We will be providing additional details and guidance will be coming out with regard to our bonus program. So we're pretty excited about it. We think it's a good way to give some love back to those that have been successful with us. So this is a slide, really my intent here is you're going to see a lot of changes coming up in 2024. The FFM has put new standards on us as carriers. And they're saying that we can only offer 4 non-standard plans per metallic level. So the days of seeing over 90, 80, 100 plans on the marketplace is going to be gone because each carrier is going to be restricted on how many non-standard plans that you can have. So it's going to be kind of shook up a little bit this year. You may see some plans in one county that may not be available in other counties. As well, the restrictions are pretty stringent from our perspective for the fact that, let's say that you have, in the past we had Insure, we had Elevate, and we had Medica with CHI. Well, we had a lot of plans in all of those networks. Now we're only able to offer 4 non-standard plans per metallic level, and it really doesn't matter on network. So it may be a difference of county by county, what's offered here versus what's offered there, or so forth like that. So I just wanted, if you've not heard it before, I just kind of wanted to draw that to your attention that you are going to see some changes within the market because of the rules that the FFM put in place. So let's talk about our Nebraska products. So our Nebraska products, you can see a map of the state. First of all, there's going to be no change in service area. So Medica Insure, Medica with CHI, and Elevate, all of those plans are going to be in the same counties they were in 2023. We're going to introduce a silver copay 0 PCP for office visit, and we're also going to do an expanded bronze plan, standard plan for all products. For the Insure, we're introducing the silver enhanced plan. Medica with CHI, what we're doing there is we kind of found a little loopy loophole where if we add an eye exam benefit to the plan for an adults, that we may be able to offer a little extended version of our portfolio in those counties. So you will see a couple of new plans with an eye exam benefit for an adult that are built in with Medica with CHI. And then Elevate, we're going to offer a gold $0 PCP copay plan. So Medica with CHI, again, is the service areas remaining the same. You can see the service areas in the lower right-hand side of the screen. We are going to bring back the popular bronze $0 copay PCP plan. And the key is that $0 PCP plan not only applies to your primary care, but also applies to urgent care, convenient care, mental health, substance abuse, as well as chiropractic. So that is a little, it's expanded. So it's a great thing. Elevate and Medica has 20 some ACOs all over the country. Elevate is our lowest cost ACO network, bar none. So it's running really well. That's going to be basically Nebraska Medicine as well as Methodist and Bryan here in Lincoln. Now with the Elevate plan, we're going to bring back the popular low deductible with $0 virtual care benefit. And then our Insure Network. Our Insure Network is statewide. We've done a fantastic job of taking the Midlands Choice Network and expanding it with deeper discounts, as well as keeping the coverage the same. So our Insure Network is going to continue for 2024. Oh, sorry, operator error. Keep in mind with Medica, if you're in an outlying area or you're in Western Nebraska, for an example, someone that needs a rotator cuff, a knee scopes, heart surgery, if they're in Ogallala, their opportunity or their likelihood of going to Lincoln or Omaha may be pretty slim. So we do have, and we have gained contracts with providers in surrounding communities around Nebraska. So this is just an example. It's not going to be one for everybody, but it's just going to be an example as to some of the facilities that you may be able to go to and attend and receive benefits. So it's a good thing. If you have members that are going to providers outside of the state and they're not in network, please let Kayla know, let Justin know, let myself know, because we'll go after them. Let's see if we can come to an agreement with them and get them in our network and make it as broad and as successful as we possibly can. So please keep that in mind. If there's somebody you're seeing maybe in Colorado or in South Dakota, give us a call and we'll work to try to see if we can get them in our network. Here is a listing of our portfolios for 2024 versus 2023. So you can see the orange, the ones in the 2023 column, the ones that are in orange are ones that are no longer going to be offered in 24, as well as you can see the blue are going to be the same CHI plans with the eye exam benefit included. And then that berry or rose color, I like rose because I probably wear rose colored glasses. They are going to be new plans. They're going to be offered in 2024. So you can see we have Medica with CHI. Now there is an error in the counties for Medica with CHI. You're not going to see Lancaster County in there. Lancaster County is a county that Medica with CHI is included in, as well as Elevate. You can see the 3 new plans that we're going to include in that Elevate product. And then our Insure Network. So you can see we are taking away some plans as well as we're adding some. I want to bring it to your attention because the question is probably going to come up and Justin's going to yell at you. Unfortunately, we're not going to have an HSA plan available for 2024. With the reduction in the number of plans that we can offer based on the area, we had to be really picky and choosy as to what plans that we're coming out with, as well as our HSAs. When you looked at them, and the top selling plans, they weren't high on the list. It could be maybe our actuary department and how we price them, but unfortunately, we're not going to have an HSA plan out there next year, a high deductible health plan. Now, if you have folks that have an HSA, and they continue to renew with Medica, they will be able to continue to spend those HSA dollars. They just can't make any more contributions. Also, we did some research and we found the number of folks that actually set up a high deductible or HSA account with their high deductible health plan was pretty low, surprisingly. I just wanted to be upfront and let you know that unfortunately we're not going to have an HSA plan this year. It looks like we do have a question.
Sam,
Hey, Pat, it's Sam.
Yes, sir.
So, relative to that HSA, obviously as a benefit guy, I mean, we kind of feel that's short-sighted, right? But Blues isn't necessarily off the same track. I mean, their HSAs are limited. I guess my question was, when I looked at Blues versus Medica in 2023, the Medica plan just wasn't really priced well. So is part of that decision just based on the lack of enrollment, and it's easier to just take something off the board that doesn't have enrollment basis to it? Is my first question. And then second question is there going to be some talk about potentially bringing in a more competitive HSA plan in future years? I know not 2024. So
I'll answer the second question first. We'll continue to put pressure on product development actuaries, Sam. If that need is there. So please let Kayla know, let Justin know if an HSA is high priority on your product portfolio list. With regard to, and I think that's probably it, Sam. I mean, you look at it and our HSAs were priced a little higher than they are other plans. A lot of times it's because they were so much richer. Your out of pocket for a non-HSA plan is so much higher than your HSA, and you have members contributing longer than they potentially would be on an HSA. So our experience with HSAs is they were running a lot hotter than our other plans, and consequently, that's probably the last couple of years why you saw the pricing the way they were, is because they were running out. Part of me says, could that be because just the out-of-pocket's lower? I don't know. I don't know the answer to that question. But again, like I said, I didn't want to not touch on that because that is a change that you will see in our portfolio in the coming year.
Thanks,
hopefully answer your question, Sam?
Yeah, it does. I mean, okay. It is what it is, right? And then I threw another question in the chat. Whenever you want to address it, you don't have to address it now.
Okay. We'll get to it at the end. Here's another change. Everybody's going to get a new ID card for 2024, which it may not be that odd, but the thing that's going to change is their new ID numbers. So not only are they going to get a new ID card, as well, they're going to get a new ID number. What we've done is we built some crosswalks in our system that if John sample member or Jane goes to the doctor and has a claim and maybe they had their old ID number, excuse me, we build a crosswalk into our system, whereas we're going to have that claim come in with that old ID number. It's going to be transferred over to the new ID number and that claim is going to be paid. So we do have some precautions built in as well. I know a question came up during our broker road shows that because we're getting new ID numbers, does that mean individuals are going to have to set up a new ACH? And the answer to that question is no. Unless the only reason they would have to set up a new ACH or a new payment mode if they're going from on marketplace to off, or vice versa, if they're going off marketplace to on. But if they're on marketplace and continuing on marketplace, they're not going to have to worry about making a new payment strategy. Or vice versa, if they're off and continuing to stay off, they're not going to have to do anything. There's going to be no change there. So, but it is something that when you're meeting with your members coming up during open enrollment, it's definitely something you're going to bring to their attention. Hey, you're going to get a new ID card, and that policy number is going to change. So don't throw it away. Jump on it, throw it in your wallet. I'm probably the worst at that. I probably have an ID card that's sitting on my kitchen countertop that my wife continues to yell at me to say, you need to put that in your wallet. So virtual care. Keep in mind that virtual care is available on all plans. On a lot of the plans, there's no cost to it. We use Amwell. Amwell does a fantastic job. They have access to a provider 24 hours a day, 7 days a week. You can choose your own provider. It's good for those that are traveling because we don't have a network in California or New York, for an example. And it's a fantastic way if you have, you know, allergies, a cold, cough, fever, flu, headaches, rashes, sinus infections, poison ivy. That would be Pat. Have used it for poison ivy, sinus infections. I mean, it's a great thing. So keep in mind that that is included in all the plans that we do have. We're introducing a new addition to our individual products, and it's called Self-Care by Able To. We've had this on our group side. It's been called Sanvello for ever since we came out with our products in Nebraska. We're just adding it to the individual side. Basically, it's helping with the mental health side of things and aspects of things. There's going to be mood trackers on there. There's going to be some tools there that someone can develop additional skills, how to handle certain situations and so forth like that, as well as a habit tracker. So that is going to be included where it hasn't been in the past. And I think lastly, I think this is the last slide, is why sell Medica? First of all, as we said, we talked about Amwell and the fact that they have telehealth wherever they go. As well, urgent care is always going to be paid at the in-network level. So if someone is traveling, if they can find an urgent care facility, that would be paid at the in-network level, and they would be able to get services and have those services covered. That's number one. Number two, keep in mind that we're continuing our insulin program, where if the insulin's on our formulary list, it's going to be $25 per month. So that is a great thing. Here at Medica, we have one deductible, and it's going to cover everything. So it's going to cover not only your medical expenses, but as well will cover your pharmacy expenses. We talked about Amwell and the $0 virtual care. Some carriers have limits on copays, and luckily at Medica we don't. So we'll have unlimited copays on most copay plans for primary as well as specialty care office visits. And lastly, and this again has some thunder and really brings some value to the members that you have on our $0 PCP copay plans. That $0 copay applies not only to your primary care, as well as going to apply to urgent care, convenient care, mental health, chiropractic, as well as those children eye exams under age 18 and younger. They're going to be included in that $0 PCP copay plan. And lastly, I said this was the last slide. Actually, I have some additional ones. I just want to give you guys some dates to kind of let you know how that business is going to be processed and handled throughout the remainder of the year. So our renewals are going to start being mailed here in a couple weeks on October 2nd, and we're going to mail those over about a week period, the 2nd through the 6th. We'll be getting those renewal letters out. The renewal letters are going to have a different look this year. They're going to be a little slimmer. We're going to show them the plan that they were on, as well as because of that reduction in the plan, we're going to show them the plan that they're going to be mapped to. So that information is going to be in the renewal letters, again, going out October 2nd through the 6th. Agent certification for IFB is coming out. We're hoping to get it out before, but if not, it should be out by October 2nd. Our formulary list, unfortunately, we're pushing them and pushing them and pushing them. We're trying to get it out. They say it's going to be out by 11/1, hopefully sooner. Hopefully sooner on that. In the past, what we've done with our billing for January is in the past couple of years, we've delayed it. And I think that's been successful in us billing an accurate amount for our members. So we're going to continue to do that this year. Our bill run for December is going to be on the 18th of December. So our bill run for January is going to be on the 18th of December. When you're meeting with your members and your clients during open enrollment, just give them a heads up. Some people get really anxious if they don't see that bill in the mail. And if you give them a heads up, maybe it's going to eliminate some phone calls that you're going to receive. So that bill run is going to be on December 18th. And then ID cards. ID cards, we're going to hold ID cards. Any ID card prior to December 7th, we're going to hold. And then we're going to ship them out on the 8th. And then we're also going to do another shipment of ID cards the same time those billings go out on the 18th. So we're kind of going to batch that first cycle, anything from open enrollment to the 7th of December, boom, send those ID cards out. And then we're also going to batch that second batch, for another 10 days and then send those ID cards out. Then after the 18th, as those applications come in, those ID cards will be generated and will be sent out. Again, reminder, just to let folks know they're going to get a new ID card with a new ID number. It's going to be pretty important to them, that first part of the year when they're trying to get services made. So I appreciate the time. We appreciate the business and the trust and faith that you guys have put your clients in with us. And it's something that we really do not, we don't underscore. I mean, it's something that it means a lot to us, and we are definitely appreciative of that. I know we have a couple questions in the chat right now, as well as if you have additional questions, please do not hesitate to type them in there.
So first we have just a comment from Sam. Thanks, Medica. Clients love the $0 plan. So that is true. And then a question on urgent care. You kind of addressed it during your talk, but Blues is doing a national urgent care. Is Medica considering this in the future? If you just want to talk briefly on that.
Yep, absolutely. So here at Medica, and it's been this way as long as I've been with the company. If they see an urgent care provider anywhere in the country, they're going to receive benefits on that. So that claim will be paid. So any urgent care provider is going to receive in-network benefits. You can be on a CHI plan and go to a urgent care provider in Scottsbluff, and it's covered. So yes, we do have that, and we will continue that.